School vaccination obligation delayed to prevent staff shortage. Despite health advice advising it weeks earlier, education officials said requiring COVID immunizations for all school personnel and volunteers was delayed until the end of the school year. SA Health informed the Education Department of the directive 2 weeks ago, after weeks of informal negotiations. There is a 2.5-week lag between now and December 10th, which is the final day of school, and the day when Delta will be allowed to enter South Australia, as revealed yesterday. The Education Department said it has ordered air filters for classrooms, and a renowned SA epidemiologist has urged for obligatory masks in elementary and secondary schools. Today, Chief Public Health Officer Professor Nicola Spurrier questioned why the vaccination requirement wasn't implemented weeks earlier, especially because children under the age of 12 can't be vaccinated. The Education Department says 685 of its 31,000 workers refuse vaccination. By December 10th, all school personnel and volunteers must have gotten at least one vaccination dosage and booked a second. Non-vaccinated employees will be obliged to take unpaid absence after December 10th. The Australian Education Union will meet on Saturday to discuss the ramifications for the education workforce. Pearce stated the vaccination obligation was established to safeguard the vaccine-inaccessible 12-year-olds. As circumstances develop, we will make appropriate decisions based on health advice, he said. An investigation is ongoing to examine if SA schools need to enhance ventilation to decrease viral transmission. Pearce said the department had ordered several air purifiers ahead of time. Professor Adrian Esterman of the University of SA says air purifiers are appropriate for schools but not masks. Esterman told in Daily that masks should be required at all schools, secondary and elementary. Esterman backed school vaccination requirement. He stated fully vaccinated persons were 80% protected from infection and that even if they were sick, they would have minor symptoms if they got sick at all. He added individuals fully vaccinated had a 5% likelihood of requiring hospitalization and a 0% chance of dying.